This podcast is talking specifically about temple fillers. I was doing temple fillers on a young 31-year-old, and it wasn't necessarily for aging, but it was just because it would give her better balance. So the temples oftentimes are underrated because a lot of people think, oh, I don't need my temples done. But the temple fill has oftentimes given such a beautiful result, whether it's with fat or fillers. And oftentimes I don't even need a full syringe to do it. I don't even need 2 syringes, although some people need 6 syringes. But the way that I strategize on the temple is I almost always look at how the temple looks from the frontal view. The reason is that from the frontal view, it tells me the scalloping that occurs or the concavity that occurs in the face and how it contributes to the patient's social interaction, because we relate to each other from the frontal view. So if I make the side view better and the frontal view looks either worse or indifferent, then I've really failed. So for example, if I'm sitting on the side and filling the temple and I really make it really beautifully full, but I look at it from the frontal view, it either hasn't improved or it becomes bulgy, then that's definitely a failure. So what I always try to do is, as I fill, is always look at the frontal view, whether it's with fat, whether it's with fillers. I'm always trying to read how it affects the frontal view. So, and if someone has a more limited budget, I'm trying to stretch that filler over their eyelids, their temples, and multiple zones, but I need some to balance in the temple. How do I strategize to make that temple look better? So I start breaking the temple into multiple zones to try to say, where is the major problem? If the patient doesn't have the budget to fill the entire temple, what can I do to make it look better? So sometimes the answer sits in the upper temple, what's called the conjoined tendon. That's the transition of the temple over to the hairline, to the forehead. That medial portion, or the portion that's sort of a semicircle or like semi-lunar shape that extends up to the forehead, that transition can be very abrupt. And sometimes just by putting a little bit right there and softening the transition from the forehead over to the temple is enough to make the entire temple look amazing. So that's option 1, is to look at that. Now, how do I make these decisions? I make the decision based on what I think, and as I put the filler in, I make other decisions. Sometimes it's just the lower temple. There's a divot in the lower temple. I put a little filler there. It all of a sudden makes the entire temple look better. Sometimes it's a little bit of both. Sometimes it's the joining whole fossa, the whole area that's depressed that needs treatment. But another area that's really interesting is the outside area. I call it extrafacial. In other words, it's outside of the face. It's underneath the temporal hairline. So you think about it, you actually don't even see the skin. It's underneath the hair. You say, well, why would that be important? Because sometimes there's a hollowness below that area that just makes the face look really pinched in and scalloped. So by filling a little bit there, it can look really, really nice. And so, but if you think about it, he said, is that the temple then? Absolutely, because if I think about a cadaver that's lost all the hair on the side, that temple expanse is actually very large. So that whole area is part of the temple, and you can still see it. Even with people that wear longer hairstyles, there's a scalloping, or in other words, there's a depression that just looks bad. So the temple is a very complex area. The way that I design it is always looking at the frontal view, and the way that I think about it is in these sub-components so that I can try to achieve the best results based on sometimes a more limited budget.